And here is the question. Right. Yes. Relevant. If you have read and understood, considering it critical care scenario station, please tell me what's happening to the patient and how would you manage this patient further?
Okay, so to me, it looks like a distributic shock or maybe a high epidural block.
Good, good, very good.
So I will go as a critical care patient. I have to go
Very
CCRISP
good.
protocol.
Yes,
I have to see the airway, if the patient can talk or not. I have
very
to see
good.
the breathing, how is the breathing rate, and then nature of the breathing, and the saturation, oxygen. Then I go for circulation. As the patient is hypotensive, bradycardia, I have to start. I will open 2 wide bore IV cannula and then start crystalloid solution. I will
Yes,
start fluid challenge 250 to 500 ml per hour for 15 minutes. And then I have to see the response.
one important thing that you have missed. If you suspect that this is epidural block has been given to higher level, then you'll stop that first.
We have to stop the
Yeah.
epidural drugs. Yeah.
Yes. Okay. Why would you think epidural would cause this kind of symptoms?
Okay, so for high epidural block, it will block the sympathetic outflow.
Yes.
And by unopposed parasympathetic system can do bradycardia and hypotension as well.
Yes. Answer could have been that, okay, one, you think that spinal level is too high, otherwise it could be increased dose, incorrect positioning,
Yes.
etc. So, yes. What would be the better, or what are the indications of giving epidural blocks?
Okay, so for a long duration of operation,
Yes.
a patient who is not good compliance for general anesthesia, and for postoperative pain control.
Yes, and all right. Can you tell me, when you consider it to be higher, what level exactly are you thinking about?
So it could be even T1 level, or maybe cervical as well.
Between T1 to T5, they say. Okay.
Yeah.
How would you be assured to confirm that you have given the epidural block at the right level?
We have to check temperature sensation, but
Yes.
not the pinprick sensation.
Yes.
So
Okay.
we have to check the level where is the sensory block is happened. So if it's like around T1, then we can say is a higher level.
By using ice packs, you can
ice pack or maybe alcohol.
Yes,
alcohol
very
swab.
good. All right. How would you differentiate if it's high epidural block or it's patient undergoing hypovolemic shock?
So for epidural block, it will be hypotensive and bradycardia. And for hypovolemic shock, the patient will have tachycardia. And the cold calm periphery will be in the hypovolemic shock, and
Yes.
the warm periphery will be in epidural block.
So what are the systemic effects of epidural block? Can you
So
mention few?
epidural,
Yes. please.
yes. So for epidural in the heart, it will cause decrease cardiac output, cardiac contractility. It will cause bradycardia. It will cause low cardiac output. So distribution of the blood all over the body will be low. That's why the patient will be hypotensive. In the respiratory, patient will maybe have a respiratory block or hypoventilation, and due to the block of respiratory muscle and accessory muscle.
Yes.
And due to the low cardiac output, patient might have low renal perfusion, and in the brain, it might cause a low cerebral perfusion.
Okay, considering the symptoms of the patient, can you please tell me if you don't get to manage the patient, what are the complications that you expect or can occur?
Okay, so the patient might have a respiratory failure, patient might have a cerebrovascular accident, patient might have cardiac arrest, patient
Yeah.
might have renal failure.
Okay. So can you give few or mention few conditions in which epidural block is the ideal to be given?
Okay, like patient with maybe lung cancer, we can do pneumonectomy or
Yes.
lobectomy.
Yes.
Then patient, even for painless normal delivery, we can use epidural anesthesia. And any prolonged operation, we can use epidural anesthesia.
Why would you prefer epidural block analgesia over spinal analgesia?
Okay, I will come back to this question later.
Okay. Can you define or can you tell me some inotropes that can be given to the patient to manage the bradycardia or hypertension of the patient in this
Okay, ma'am.
condition?
So we can give adrenaline or adrenaline,
Yes.
or we can give even dopamine
Yes.
or dobutamine.
Okay. What would be the positive effects of these medications that you have?
So for inotropic, will increase contractility of the heart. That will increase cardiac output. It will increase after load, and it will increase cardiac output of the patient.
Yes. Then it will increase the preload and then the afterload as well.
Yes, and then it will increase. It will increase venous contraction. So vasoconstriction, that one also increase venous return.
Okay. All right. What are the conditions in which you will abstain yourself from giving epidural block to the patient? When you cannot
if the
give.
patient is having any respiratory symptom like COPD or asthma, if
Yes.
the patient having any
Okay.
any infection like meningitis or
Good.
yeah.
Good. Right. Thank you. Well went. Thanks.